Welcome back to the Metro on WDET, Detroit Public Radio. I'm Robin Vincent. The final medical decisions in a person's life are among the most difficult anyone can make. They can include how to proceed with treatment for someone with a terminal illness or to cease it altogether. When that person is unconscious or unable to make that decision themselves, family, next of kin, are often the ones who decide. But in practice, carrying out the wishes of a loved one is not as simple as it seems. Without having the legal paperwork done up front, a complicated set of state laws and regulations can require next of kin, called patient surrogates, to appear before a judge before medical decisions can be made. And that can waste precious, fleeting moments on bureaucracy. A new set of bipartisan bills aims to close the medical decision-making gap in Michigan, allowing next of kin to make critical decisions when needed. Joining me now is one of the bill's co-sponsors. Jamie Thompson is a Republican member of the State House. She represents Michigan's 28th House District, which includes Brownstown, Flat Rock, Woodhaven, and other downriver communities. She also serves as vice chair of the House Health Policy Committee. Representative Thompson, welcome to the Metro.
Thank you so much for having me.
So first things first, why does Michigan need a new law for medical decision making?
Well, because actually there are no laws on the books. So currently under Michigan law, if a loved one were to become incapacitated and not able to make medical decisions for themselves, which usually happen in an emergency situation, that family member will have to go to the court to petition the court to become guardian to make those decisions for them if there is not a current advance directive in place. And as a nurse, a practicing nurse, believe it or not, I had never run across that in my career until it happened to me with my father in 2023. And then I really saw that gap in the system that needed to be filled.
Can you tell us a little bit more about your personal experience? What happened? What did you see when attending to your father and what he was going through?
Yeah, so even as a nurse, as I said, I was not involved in politics, and I didn't know that Michigan was what you would say was not a next of kin state. And my father had moved back down to Kentucky, and he was down there for probably about 15 years. I ended up getting the phone call in 23 that he had had a heart attack in Kentucky. And unfortunately, the heart attack left a hole near his aorta. And it was inoperable, meaning they couldn't operate. It was too close to the aorta. It was calcified. And he was given 10 days to live at that point. He was still alert and oriented, still able to talk and make his wishes known. I drove down to Kentucky after only being a legislator for literally less than a year. So I was an elected official at the time. Drove to Kentucky, spoke with the doctor, spoke about the diagnosis. Having a medical background, I understood. We had the conversation with my father. This is unfortunately what's happening. You know, do you understand? I know you feel okay right now. When they start taking some of the fluid off, he started feeling a little better and thought maybe he was going to recover. And I explained to him that they couldn't go in and they couldn't plug the hole, meaning he would begin to fill with fluids and, other systems would shut down. And honestly, Dad, it's going to be 10 days. What do you want to do? So we talked about hospice and we talked about what that meant. And he agreed in Kentucky. He wanted to go hospice. He obviously wanted to be a do not resuscitate. Here's his advance directives. I spoke with the physician and I said, do I need to go get power of attorney since I'm here in Michigan? I live in Michigan and he's in Kentucky. Should I speak with an attorney while I'm here, to make sure everything is legally in place? And he said, no, you're his next of kin. And I'm like, oh, okay. I had never, this is the first time one of my family members, my parents, had become ill, so I'd never faced it myself. And my dad wanted to come back to Michigan to pass away here. So I come back to Michigan. I make all the arrangements for him to be put into a nursing facility that was close to my home. Now we're probably like on day 6. And he gets to Michigan and everything changes. They just said, number one, he's now confused. You don't have a binding document that says you can make decisions for him. So you're going to have to go to court and file a petition for guardianship. And I'm thinking, okay, We're on day 6. This is usually pretty 10 to 14 days. In Wayne County, I'm going to go get guardianship. That's not going to happen. And I'm not going to go sit in a courtroom and not be with my dad as he's passing away. And then also, they would not allow his DNR that he had signed in Kentucky to be active in Michigan, which means even though he was hospice, they made him a full code. And even the nurses was like, why would we do this to this man? This man, now he is very confused. Now he is semi-comatose. And I'm a nurse. I'm an elected official, and I'm calling everyone I know, and I'm trying to navigate this system. And it ended up working out that I had to very strongly advocate for my dad and go to the director of hospice, the physician, and say, I'm not allowing them to send him to the hospital to be resuscitated, to put on a ventilator when this was not his final wishes. So the director of the hospice organization, he ended up having to take responsibility, meaning that he agreed to make him a DNR, but should something happen, he would have been sued. So I really quickly realized, after my dad did pass away comfortably and peacefully, and I was with him, and it was right kind of at that 14-day mark. So I could have been tied up in court for gosh only knows how long, and I would have lost precious time with my dad. So when I came back and started talking to colleagues and talking to different stakeholders, it was like, wow, we really are not a state that recognizes family members in that situation.
I think listeners can appreciate that you have taken this personal experience and you are now trying to shape policy because of it. And it sounds like what you're trying to do for other folks is really eliminate unnecessary stress during a very difficult time. And as you also mentioned, make sure that people have those last precious moments with the people they love. So, Representative Thompson, the bill you've introduced would hopefully avoid the kind of emotional toll and stress that you were experiencing. What exactly would be different?
Well, this first and foremost, people need to understand that this does not supersede any advance directive that is in place legally. That's still a legally binding document. So if families and couples choose to obtain an attorney and have advance directives put in place and give power of attorney to a loved one should they become incapacitated, whatever that looks like, that would still supersede this. This literally means in an emergency situation when decisions have to be made, it would follow what you would assume naturally as just the typical, and I know they call it a surrogate decision maker, and I kind of started getting away from that phrase a little bit when I was working on this legislation, because when you hear that, I think that, a layman person doesn't really understand what that means. They're like, surrogate, is that about pregnancy? Where do you get surrogate from? So really, just to keep it simple, it just allows that person that's their next of kin, and it follows the hierarchy like you would imagine it would, like you quote unquote see in the movies, where if it's your spouse, you don't have to have guardianship. You would immediately be able to make those legally binding medical decisions for them. And then it would go down to a child, and then down to a sibling. And then we even made sure that we covered all of our bases and thinking through to make sure that, say someone isn't married and their significant other that they've lived with for, 20 years, but maybe they were not married, that they would also be on that list of people that could be able to make those decisions. And that stays in their medical record. And then should anything change, because we know how family members and dynamics can change, if something were to happen and the person is their decision maker, their child, and the child decides they don't want to be the one, that can just be changed with a vote of the family members and a doctor present, and that gets changed in their medical record and kept right in front of their medical record so they know daily.
So family members, a vote of the family members, is that how then we're deciding next of kin? Is that how they are prioritized in this bill?
Well, it would first and foremost be prioritized as their spouse.
Right.
Then their living child, adult child. Then their sibling. Then a significant other. And then if there was any type of arguing among the family members, if they got to a point that so-and-so was not able to make that decision, or they decided they did not want to, or you had, and this does happen, dad gets ill and there are 5 living children, and they're arguing over who's going to be the one to make the decisions. And it's tough when it gets to that point. But then there would be, a vote among the family members, and that would be the person, the child that got to make the decision. So no one felt like they were not getting the opportunity. And usually there are family members that I've seen in the hospital that, like my situation with my mother. So now I have one living parent, my mom, and she's completely healthy. And I have my sister who's 12 years younger than me. And she just has already said, I don't want to be a part of that decision making. I know you're a nurse. I know that you would understand things more than I would. And so my mom, she's already made me her, decision maker should something ever happen to her. But again, in a situation that nothing is legally documented, now that family member just will not have to go to court and get that guardianship of someone to make that decision for them.
This is the Metro on WDET. I'm Robin Vincent. My guest is Republican State Representative Jamie Thompson. She represents Michigan's 28th House District, which includes several downriver communities. She also serves as vice chair of the House Health Policy Committee. We're talking about bipartisan legislation she's introduced to simplify and speed up medical decision-making here in Michigan. Now, Representative Thompson, one thing we have not yet talked about, which is an important part of this equation, are healthcare workers. And there's really a balance to be struck between the patient's wishes, a doctor's opinion, and existing laws, which in this case can require precious time in fleeting moments, as we've discussed. You make laws for a living, but as you have mentioned, you're also a registered nurse. How does the current law impact the work doctors and nurses do, especially those who are working in hospice and palliative care?
Currently, it's very frustrating. Since introducing the legislation, I've had so many healthcare workers and nurses, majority being in hospice, come forward and say, thank you so much for doing this. And until it happens to your family or until you have a patient that you're in that situation, you would not know. So, as a nurse, as soon as you take on your patients and as soon as you get report on, your patients, your caseload for that day, your census, the first thing you ask is, are they a DNR? Are they a full code? So you need to know as a nurse, if something were to happen, should they stop breathing? Do they not want to be resuscitated? Right. Do they want to be resuscitated? So that's first and foremost. But because it's not as simple as just do not resuscitate, there's actually, when you're admitted to a hospital, you're choosing not just do you not want CPR, but, maybe I want CPR, but I don't want to be on life support. Maybe I want to be on life support, but I don't want a peg tube or vice versa, a feeding tube, because there's so much more involved, and it doesn't have to be, don't save me at all. There's still things that you can say, I choose this, I choose that. These are your rights as a patient, and you give those to your physician and to your nurse. And as a nurse, part of your role, not just in taking care of patients and being a caregiver, but it's number one, being that an educator to that family and letting them know that these are their rights. These are the risks of the procedures. This is all the information for you to make that decision for yourself. And as a nurse, you educate that patient and their family, the family first and foremost, and then you advocate for them. You advocate for their wishes. So when you know that you have a patient, especially with hospice, that they're in great pain, they have a terminal diagnosis, you want to comfort them, and you want them just to have comfort measures and to pass away peacefully if that was their choice. So if there's nothing binding you, it's kind of like it ties your hands. And I saw that in the facility where my dad was, because the nurses that were taking care of him, they didn't want to go into the room when he passed away and pound on his chest and do CPR and crack his ribs and send him to the hospital when he was 112 pounds now because he was so sick. And they're like, I know this really sucks. I don't want to be forced to have to do that, but until his code status changes, I have to legally do that. So I, as a very feisty person in general, I stayed with my dad for those 3 days until we got it figured out. And he did not pass away, obviously, but had he, I would have stood in front of the bed and I would have said, no, you're not doing it. And that puts them in a difficult situation. It shouldn't have to be that way.
So yeah, if I'm hearing you correctly, it's that right now there is too much responsibility falling on doctors and nurses, and you want to help to alleviate that. Given your profession as a nurse, I have to say that when I've been in the hospital, when I've been sick, nurses have been the ones that have been pivotal to my healing. And I know I'm not to diminish the work of a physician, but that kind of true, the educator role that you mentioned, and also this role of a compassionate healthcare worker and advocate, you really feel that from a nurse in a way that you don't always feel from a physician. And so if we can make a nurse's role a little bit easier in the way that you're describing, that makes a lot of sense.
Absolutely. It's that bedside care that there are, very good physicians that will take the time with families and sit with them, but their caseload is high, and the role and the scope of the nurse is to be that caretaker, educator, and advocate. And that's something else that I've been strongly working with stakeholders in Michigan to make sure that we are supporting our nurses, not just with this legislation, but other legislation that we're working on to ensure that they have that time to spend with the family members. Because when you're taking care of so many patients, you're doing everything just to provide care, but you're losing that time that you could be giving to them to educate. And that education piece is so important on their recent diagnoses or chronic diagnoses, or just making sure that the family understands, because that's usually the person, the patient is usually really, I don't want to say the problem child, because the patient is just thankful that you're caring for them. But, sometimes it's that family member that when they don't understand, they get a little grumpy and aggravated. And I would too. But as long as you're communicating with the family and letting them know everything that's happening and this is their choice, they're way more satisfied and happy, and they feel safer.
Representative Thompson, we have run out of time, but I can't let you go without asking you one final question. And we only have about 30 seconds here. But the Michigan State House is stuck in a gridlock over the state's budget. And there are hundreds of other bills in the State House and Senate that have yet to be taken up. So as briefly as you can, what chance do you give this bill to pass this session?
I do believe that this bill will get a vote, most likely in the fall. I'm hoping September or October. It has passed out of judiciary with bipartisan support. I think it's very important, and I know that this is something that should be done because it's not partisan. We can do things.
Jamie Thompson is a Republican member of the State House. She represents several downriver communities in Michigan's 28th House District and serves as vice chair of the House Health Policy Committee. Representative Thompson, thanks for joining us on the Metro.
Thank you.
This is WDET-FM, Detroit Public Radio, your connection to news, music, and conversation. And this is the Metro. Stay with us.